It's really difficult to put it into words because the National Breast Cancer Foundation have done so much in those 30 years.
We do research because the end goal of that research is to save lives.
I had hope that I'm going to be okay. Time meant for me that I could be there for my children. I was diagnosed at 35. I didn't know that it could happen to someone as young as I was. I said, am I going to die? The doctor said, Renee, if you were diagnosed 5 years ago, my answer to you would be very different to what it is today. That year was very tough. You know, I missed my son's Year 7 graduation, my daughter's dance concert, but I had hope that I was going to be for them for a very long time coming.
My fiance and I were due to get married in September 2020, but because of COVID and the world was shut down, we had to cancel. On the day we were meant to be married, I found 2 lumps in my right breast. I remember taking it day by day and just focusing on what was happening there and then.
There's researchers who are working every day fundamentally to try and improve the way that we're diagnosed and ultimately that lives are extended. I'm really hopeful, and I know there are so many more researchers out there that are working on things today that are going to make an impact long term, but knowing that it isn't a death sentence, and that's something that we all are working towards.
We're always thinking about the lives that we can save. We're not at 0 deaths. We need to keep funding this research, take the ideas that are developed in Australia and around the world and move them into patient care.
With new treatments, we've actually changed the natural history of breast cancer. Breast cancer continues to evolve. So there is an ongoing constant need to better understand how this evolution of breast cancer is occurring. So that is my hope. And the impact, not just on the patients, but their families as well, is critical.
It doesn't matter what age you are, it doesn't matter what sex you are. Breast cancer does not discriminate. And so having that vision of 0 deaths from breast cancer, it's priceless.
Nobody should die from breast cancer. The National Breast Cancer Foundation is working tirelessly to raise funds for this critical research. I'm quite privileged to be alive now because of the impact of the National Breast Cancer Foundation.